Today we'll be covering the recent American Gastroenterological Association and American College of Gastroenterology Guideline for Pharmacological Management of Chronic Idiopathic Constipation. This guideline was published May 19, 2023. The patient population of interest is adults 18 years and older diagnosed with chronic idiopathic constipation, and the guideline is intended for use by gastroenterologists, primary care providers, and other allied healthcare professionals caring for patients with chronic idiopathic constipation. This guideline was developed using the Grading of Recommendations, Assessment, Development, and Evaluation Evidence to Decision Framework, also known as GRADE. This framework categorizes recommendations by the strength of the recommendation, strong or conditional, as well as the certainty of evidence, high, moderate, low, and very low. Throughout this video, we will be using abbreviations to keep things simple. Chronic idiopathic constipation will be simply referred to as CIC. Over-the-counter, of course, will be OTC. Polyethylene glycol will be shortened to PEG. The American Gastroenterological Association will be AGA, and the American College of Gastroenterology will be ACG. Introduction. CIC is a common clinical diagnosis that affects approximately 8 to 12% of the U.S. population. Non-pharmacological therapies often represent the initial steps in management and may include dietary changes such as increased fluid intake and increased dietary fiber, as well as behavioral changes such as exercise. Pharmacological treatment may include both OTC as well as prescription medications such as PEG, secretagogues, or prokinetic agents. Did you know a significant portion of patients with CIC are not satisfied with their treatment and may use multiple OTC medications followed by prescription medications before they have any improvement or full improvement in their symptoms? Let's dive into the recommendations. These will be categorized by therapy type and will include the recommendation statement, the grading, and even a few implementation tips. Fiber. In adults with CIC, panel suggests the use of fiber supplementation. This is a conditional recommendation with low-quality evidence. Implementation tips. Fiber supplements can be used as first-line therapy for CIC, particularly for individuals with low dietary fiber intake. Dietary assessment is important to determine the total fiber intake. Encourage hydration with the use of fiber and advise patients that increased flatulence is a commonly observed side effect. Osmotic laxatives. In adults with CIC, panel recommends the use of polyethylene glycol or PEG. This is a strong recommendation, moderate quality of evidence. Implementation tips. The trial of fiber supplement can be considered for mild constipation before PEG use, or even in combination with PEGs. Side effects of PEGs include abdominal distension, loose stool, flatulence, and nausea. In adults with CIC, panel suggests the use of magnesium oxide. This is a conditional recommendation with a very low quality of evidence. Panel suggests starting with a low dose, then increasing if and when necessary. Avoid use in patients with renal insufficiency. In adults with CIC who fail or are intolerant to OTC therapies, panel suggests the use of lactulose. This is a conditional recommendation with a very low quality of evidence. Implementation tips. Bloating and flatulence are dose-dependent and common side effects which may limit its use in clinical practice. Stimulant laxatives. In adults with CIC, the panel recommends the use of isocodil or sodium picosulfate, short-term or as a rescue therapy. This is a strong recommendation with a moderate quality of evidence. Implementation tips. Short-term use is defined as daily use for 4 weeks or less. This is a good option for occasional use or for rescue therapy in combination with other pharmacological agents for CIC. The most common side effects are abdominal pain, cramping, and diarrhea. Panel suggests starting at a lower dose or increasing the dose as tolerated or needed. In adults with CIC, panel suggests the use of Senna. This is a conditional recommendation, low quality of evidence. Implementation tips. Panel suggests starting at a lower dose and increasing if needed. Abdominal pain and cramping may occur with higher doses of Senna. Prescription medications. All of these medications may be used as a replacement to OTC medications or in combination with OTC medications. So something to keep in mind as we go through these recommendations. In adults with CIC who do not respond to OTC agents, panels suggest the use of lubiprostone. This is a conditional recommendation with a low quality of evidence. Nausea may occur, however, the risk is dose-dependent and seems to be lower when taken with food and water. In adults with CIC who do not respond to OTC agents, the panel recommends the use of linaclotide. This is a strong recommendation with a moderate quality of evidence. The use of linaclotide may be associated with side effects of diarrhea leading to discontinuation of treatment. In adults with CIC who do not respond to OTC agents, the panel recommends the use of plecanatide. This is a strong recommendation with a moderate quality of evidence. The use of plecanatide may be associated with side effects of diarrhea leading to discontinuation of treatment. In adults with CIC who do not respond to OTC agents, the panel recommends the use of prucalopride. This is a strong recommendation with a moderate quality of evidence. The use of prucalopride may be associated with side effects of headache, abdominal pain, nausea, and diarrhea. Key takeaways. The following OTC medications are recommended by the AGA and ACG: polyethylene glycol, or bisacodyl, or sodium ketosulfate. The following OTC medications are suggested: fiber supplementation, magnesium oxide, lactulose, and senna. The following prescription medications are recommended: canatide, valproate, and linaclotide. And the following prescription medication is suggested: lubiprostone. So there you have it, a recap of the 2023 AGA/ACG Guideline for Pharmacological Management of Chronic Idiopathic Constipation. You can find the guideline summary, pocket guide, patient summary, and many other great resources on our website at guidelinecentral.com, or by downloading the Guideline Central mobile app, available on both iOS and Android devices. So thanks, and we'll see you next time.